HIV comes with numerous other problems like skin rashes. More than 85% of HIV patients experience a rash at one point of time. As the immune system weakens, the vulnerability of getting infected also increases. The rash can also be a result of the medicines that one could be taking. As the number of white blood cells in an HIV patient falls, the risk of infection increases. The skin rashes are generally noticed after 2 to 3 weeks of coming in contact with the virus. The rash is a skin problem, but it does come with other symptoms like flu. The rash usually impacts the body's upper parts such as the shoulders, chest, and neck, behind the ears, face, hands and the torso. Sometimes even the palm of the hands gets a rash, which is mostly flat. It can also be a little raised in some cases with tiny spots or dots that look like eczema, and is often found in people with lighter skin color. Unlike other rashes, the HIV rash isn't usually itchy and disappears in less than a month. In severe cases, a person can also experience blisters in and around the most sensitive parts like mouth and genitals. The skin can also start peeling, causing painful sores. Medicinal rash. Rashes might also occur due to the antiretroviral medicines used to treat HIV. Medicines like Campronavir, Abacavir and Nevirapine are few examples. Acute HIV rash. These usually occur in the beginning of the infection and are quite noticeable. Parts where they can be commonly found are thorax, back and palms. These types of rashes are also hard to diagnose and require different body tests for a complete evaluation. Symptomatic HIV rash. These can be experienced in the third phase when a patient is more vulnerable of developing skin rashes because of dermatitis. The rashes are itchy and can be pink or red in color, lasting from 1 to 3 years. The parts where they occur are the groin, face, scalp, and back. Herpes rash. If an HIV-infected person is also suffering from herpes, then the chances of having rashes are more. Such a case could be extremely serious and the rashes can get ugly and out of control. Molluscum contagiosum rash. This kind of rash occurs usually in the upper body and the limbs. In the inner areas of the thigh, genitals and the abdomen. Usually the rashes don't itch and look more like one has eczema. However, the ones caused due to drugs and its side effects usually in the later stage of infection causes itching. At times, a rash which is generally not that itchy in the beginning may later cause itching in case one consumed any faulty medication. Therefore, to visit a doctor right after the rash appears is important in order to find the cause and treat it accordingly. Some other types of HIV rashes are psoriasis, seborrheic dermatitis, eosinophilic pustular folliculitis. The most common way by which these rashes are managed is with certain steroid creams and antihistamines, but it's not a permanent solution as the conditions will be too complicated to be eradicated completely. In the initial stages, the conditions improve significantly with the help of antiretroviral treatment. Another option is the phototherapy that helps with managing folliculitis in some patients. Depending on the rash cause, an OTC medication like hydrocortisone cream can help reduce itching and size of the rash. But serious rashes require prescription medication from your doctor. Here are other tips that can help the patient help deal with the rashes. Better avoiding hot showers and baths, and keep the affected areas clean. The toiletries and detergents should be mild or chemical-free. Silk, linen or woolen clothing must be avoided. Cotton is the best option. The clothes should also be light. An air humidifier could also be of a great use. Also avoid heat and direct sunlight.
If you have found the video helpful, please like, share and subscribe to the channel Health Destination for more health updates.